As Black adults, are we 10, 20, 30, or 4% more likely to die of heart disease or with higher rate?
40%.
Who said 40? Raise your hand.
Lorrington.
Okay,
You
40?
can't see that. Yes.
Close, it's 30%. So this is
Oh,
extremely important. It's 30%. And we
okay.
also have higher rates of, yes, hypertension,
Hypertension.
obesity,
Obesity.
obesity,
Mm-hmm.
diabetes,
Mm-hmm.
and we know that
Right.
all of those are what? Higher risk factors for cardiovascular disease. So
Right.
Black women are disproportionately affected with high blood pressure at higher rates across the world. Okay. So these
Mm-hmm.
topics are important because diabetes and stroke are very important factors as we look at that. And finally, a fact that I did not know until preparing for this call, over half of the heart failures of those hospitalized among adults less than 50 years of age are us, are Blacks.
And Lisa, did they break that down into males or females? Did they
No,
say
that
that?
that rate we didn't have for heart failure and
Mm-hmm.
hospitalizations. I don't have that rate, male or female,
Mm-hmm.
but what I do have is this fact: under 50. So
Mm-hmm.
it's so important tonight that we come back together to talk about how diabetes affects that. Now, I want you to think back a couple of sessions ago. We talked about knowing your labs. So think about this. Cynthia is going to talk about it. Do you know your hemoglobin A1C? Do you know your cholesterol? Do you know these things and how these all are affected? So we want to bring this home and tie it all together tonight. All right. So let's get started. Cynthia Thompson is no stranger to us. She has presented again. She has recently received her doctorate. So she is Dr. Cynthia Thompson now. But Cynthia, I'm in your old stomping grounds. I'm in New York City.
Oh, yay, my hometown. Tell New
Yes,
York hello.
I will tell New York hello. We thank you, Cynthia, for your service. She served in the Army and she trained at Duke. We are reminded from her bio that she is an oncology nurse, and she went into oncology nursing because she lost her father from colorectal cancer. We thank
Right.
you, Cynthia, for your passion and your commitment to understanding our underserved and underrepresented communities and wanting to help us in all that we are doing to understand how to be better educated, informed, and aware so that we can make better decisions about our health. Cynthia, without further ado, the AAHRI family welcomes you and we're ready to hear from you.
So thank you, Lisa, for the great introduction. I just want to go over the two types of diabetes while we're talking about diabetes. There's two types. We have diabetes 1 or type 1, and then we have type 2. So Lisa talked about that we essentially have cardiovascular disease, right? And we talked about the three, we call them the threes, D's, and we call them hypertension and we call them stroke. We all know family members that say, oh, they got sugar in their blood or however you want to explain it. But more white people have type 1. Do we know the difference between type 1 and type 2? Has anybody read any information on this or know anything about type 1 versus type 2? And if you don't, it's not a trick question, right? It's just the understanding that when somebody tells you you have diabetes, they might say, what type do you have? And you might say, well, I don't know. So it's important to know whether you have type 1 or type 2. Type 1 tends to be the one that is genetic environmental, right? So that means you are under the age of 30. Most of the time, you are insulin, you have little or no insulin. So it tricks the beta cells that we call them there are being destructed that's in our pancreas, right? So this really happens at a young age, and you'll see some kids, they have insulin pumps, but under the age of 30, we call that type 1, more common in the Caucasian race, right? So type 2 is what we normally get when we talk about we African Americans, right? We call
Right.
that insulin resistant, right? That means we're still secreting some insulin, but we're not secreting enough, right? So either we become insulin dependent or we can, if we watch our A1C, go on something that we call pills for insulin, right? And it's not insulin, it's actually glucose, right? So when you think about it, right, and you think about going to the doctor and you get the checkup, they check your A1C. How many people have gotten their A1C done this year or with their physical?
I have.
Okay. And what did the doctor explain to you? Because I think it's really important that we talk about what A1C is and where you're at on the pre-diabetic or diabetic, right? And then we have to look at age, and there's certain factors called estrogen that we have to look at that plays a very, very important factor. So what did the doctor say most of us, our A1C? I'll be happy to share mine. I have came back as a pre-diabetic, right? That means that my A1C was probably anywhere from 5.7 to 6.4. How many people have been diagnosed with pre-diabetes, and what are you doing if you have to actually change that to being normal? Anyone in here?
I just had mine checked. It was not pre-diabetic, but you asked the question before, what did my doctor say about it?
Mm-hmm. Mm-hmm.
What he said is, and I go back every 6 months just to keep
Right.
myself in check, but he tells me it's a better checked than the fasting blood glucose because it tells you what your glucose is doing over an extended period of time for like
That's correct.
3 months, so that
That's
it gives
correct.
you a better a, sense of what your levels are doing because it's a
Mm.
cumulative effect of the glucose, not just a one-time shot.
That's exactly right. And Lisa, if he explained or anybody have told you why I'm doing an A1C, because if we're not asking the question why, then we're going out to say, oh, I just got my A1C check and it's normal. We need to get in a routine to ask the doctor, well, why are you checking that, right? And the doctor might say, well, do you have diabetes, which I do, that runs in the family, right? Because we know that it's a strong genetic predisposition, right? That means that maybe it's associated with a family member. My grandmother had diabetes, right? But it skips a couple generations. My sister doesn't have it. Doesn't mean that I have it, but I'm staying on my A1C and doing the proper thing that I need to do. Lisa mentioned something about African Americans. African American females have the highest incidence in Native Americans of diabetes. I'm going to say that again. We all know people on TV that have had diabetes, right? And so I'm going to say that again, that between the age of 65 and 74, I'm not saying that we're there yet, but that's when we really start to see that peak, right? In what we call pre-diabetic, right? Well, our body slows down, right? What else do you think diabetes can make us more susceptible to having an A1C that is out of whack? What do we complain about that is the most thing that happens when we lose estrogen or when we get older because our body slows down? What happens to us with estrogen? Where does that fat tend to go?
Hold
Come
on,
on
pause, let them answer, Cynthia.
now. Okay.
Come on, ladies.
We all have it.
Normal.
Ask
Stomach
it
area?
another way. There's Lillian. Go
Okay.
ahead.
Is it in the stomach area?
Yeah, there you
Yeah.
go. There you hit
Mm-hmm.
it. It is that
Mm-hmm.
fat, which we call hyperlipidemia, right? It is that fat in our stomach Those estrogen pods, the estrogen is gone. I can't get rid of that stubborn fat. You see it on TV. Anybody want to get their stomach done to get rid of that stubborn fat? Yeah, we just want to exercise and get rid of it, right? We don't want to go through a procedure, but you're exactly right. Hyperlipidemia, that's what we're talking about. Fat cells in our guts, right? Obesity is a huge problem with America in general, but especially for African Americans. What else? Exercise. As we get older, we're saying like, "Oh, I don't really want to exercise. I don't want to do it. I've been working all day," right? All these are not causes, but they may contribute to that diagnosis of diabetes. I'm going to stop right there and ask if you have any questions before we talk about the connection.
Thank you, Cynthia, for, kind of just talking about diabetes so that we kind of have an understanding so we can bring it all together. Don't be shy. Did it make sense what she was talking about between diabetes and some of the risk factors? But she'll get into more of that with these slides.
Yes.
Okay.
Okay. So understanding the connection between diabetes, stroke, and heart disease. Lisa, you can move the slides for me. Why does this really matter, right? The importance of discussing diabetes, stroke, and heart disease. These conditions are among the leading causes, and Lisa said that the leading cause of morbidity and mortality, especially in the diverse community. Do we know why? Why is that? Is it because we're not getting our proper checkup? Is it not that when we say we hear something at A1C of greater than, what did I say, greater than 6.4? When you're 6.7, you're considered a diabetic? Is it that we ignore all the symptoms? Like, are we fatigued? If we drop something on our foot and it takes 2 months for it to heal, you're like, oh, this is stubborn. Let me put some salve on it. Let me just do something for that, not thinking that it might be the beginning of diabetes and that is a symptom, right? So, so are we incorporating some issues of health disparities and how they affect our understanding and management of these conditions? Well, we have health disparities everywhere. But do we trust? It goes back to trust in our physician. And it also is, are we reading the facts? Are we going to our physician's office asking relevant questions? Don't let them rush you out the office. Doctor, I don't know what an A1C is. I just know my grandmother had her leg actually cut off because she had hypertension, and I'm getting above, like kind of above myself. She had hypertension, and then she had what we call poor circulation, another word for vascular disease, right? Or peripheral vascular disease is what we call it. So the circulation wasn't happening because she was a diabetic and she had hyperlipidemia, right? What happens with hyperlipidemia? Fat gets around our heart. Guess what? It causes clots. Easy way to explain it, it breaks off. And then we've got all types of issues that can go from our heart to our legs, to our lungs, to our head, to our brain, to all significant organs. And where actually is insulin made? Do we know that answer? Does anybody know that answer before I go to the next slide?
I can't answer. Somebody else answer
The pancreas,
Pancreas.
it. There you go.
Okay.
Great.
And some is
Before,
made where else? In the liver, right? So some of the drugs that we give actually, and we'll talk about that, is metabolized through the liver, right? So next slide, Lisa.
okay.
So when we explain how diabetes can increase the risk of stroke and heart disease, we know that hypertension, right? And we think about diabetes, sugar is what it is, right? So if you have too much sugar, or because you have diabetes, it increases your platelet count, right? It promotes thrombocytic diseases. And when I say thrombocytic, that is just another fancy name for a clot. Okay. That can happen. And when that clot moves, it moves to our lungs, it can move to our brain, it can block off the vessels in our heart, right? So then that hyperlipidemia causes hypertension, right? Or vice versa. But hypertension then leads to a stroke. A stroke leads to mortality and morbidity, right?
Mm-hmm.
So who is at risk? We just talked about females, but we all at risk, right? 65 to 75 is the most common age, and that's just statistics. Next slide, Risa, please. So here are some of the lab tests that they might do on you, right? That's important to make these tests. We talked about now when you go to the doctor, sometimes they say you need to do a fast and blood sugar, or sometimes they say you don't really need to do one for your A1C. What has been your experience when you have went to the doctor and they said they want to check, and we always say sugar, but check your A1C? What has been your experience? Do they have you fast? Do they have you not fast? Do they say do not eat anything for 6 hours? What's been your experience? And I'm talking to the group.
Fasting has been my experience. They've
Yes.
asked me not to eat anything when it's time for them to take the blood.
Okay, how about anyone else?
Same here.
Same.
No,
Okay.
same here.
Well, what
Mine,
about when?
Same.
Mhm.
well, mine has been in the past, I had to fast, but in the last couple of years, no.
Me too.
Right.
Me as well.
Right.
Yeah.
And my provider will ask what I have eaten so that
Uh-huh.
they are able to document that and consider that based on the
Mhm.
results when I have not fasted and they wish to monitor specific labs that they just want to keep an eye on.
So my experience had been both. The last time I went to the doctor, she told me to fast. I did not. I made a mistake. So it came back a little high. The next time I went back in a month, she said, I need you to really fast. Are you fasting? So I fast, came back the same, right? So it was real. It was pre-diabetic, but I have, again, I think it's physician preference, and I think it's based on the lab. Either way, if you're also getting that your cholesterol check, right? Have you been asked to fast for that?
Yes.
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 Yeah.
Yes.
So what if someone tells you what are the bad cholesterols? Have your physician explained the bad cholesterol and how that really affects everything that we eat, diabetes, everything that we drink? What has your doctor told you about which one of the tests are the bad ones? Is it the LDLs or the HDLs?
The LDL.
And what are the LDLs associated with? What do we know about that? Is it triglycerides? Does the doctor ever tell you about your triglycerides? How is that fat metabolized? When we connect the dots,
Really good?
No, it's bad.
It's sweet.
It's sweet?
I put too much pickles in it.
Oh, it tastes sweet to me.
oh,
Tastes
okay.
We'll mute somebody. Who do we need to mute?
Okay, enjoy that. No problem.
So the LDLs, you're absolutely correct. Those are the bad ones, right? Those are the ones that causes heart attacks. Those are the ones that we get put on medication. Who's on medication? I remember we have a couple people on medication for LDLs. We have people on medication for high cholesterol in this group, or it was some questions asked about it. My husband, I can tell you, he has high cholesterol. But when we talk about high cholesterol, he had high cholesterol at 25. So we know that that is someone has passed on, as they say, or he's at risk for a heart attack. His father died at a very young age of a massive heart attack. But what did he have? Diabetes, heart attack, hypertension. He had all of that. And he was insulin dependent. But he was thin, he exercised, but some things are not caused by environment. Some things are genetic, right? So now, unfortunately, my husband, he was not able to take statins. So now I put him on a drug that he gets sub-Q. So it can be metabolized, not it's metabolized in the liver versus in the kidney, right? So he doesn't have all those side effects. But because he has hyperlipidemia, he's at risk for getting what? Diabetes. Because he's not getting rid of fat. Fat turns into what? Glucose turns into what? Sugar turns into fat. We can't get rid of it. It's just a big cycle. So if you have one thing could cause another thing could cause. So every time you go to the doctor, you're like, "Oh my God, I've got hypertension." But guess what? You've got high cholesterol to go with it, right? So what am I saying is that all these things that we see right here, these one, two, three, four things, is like a piece of the pie, right? So we go in, we get help from lab tests. Lab test tells us what's wrong with us. We get diagnosed. We have either blood glucose levels high, or and then we do A1C. You know, blood glucose anywhere from 70 to 100 is normal, right? 120 we're not alarmed, but 150 we are, right? Then you get your A1C done, right? We have autoimmune diseases that can cause diabetes, but then we got cholesterol. How do we eat? What are we eating? Are we have diets high in what? Glucose, sugar, right? Bad for us. As we get older, we can't sustain the same things we did when we're young. When we're young, we don't know this, but we're harming our body. I wish someone had told me that. But and then guess what else happened? You have stress, right? Or you have high blood pressure, right? Everybody in my family has high blood pressure. Everybody. My mother had it at a young age. I have it. What do I try to do? Maintain it. Maintain it. Because when you what cardiomyopathy is another condition, coronary artery disease, when we talk about that, when you have a large heart, right? Too much blood is pumping, the lungs get full of fluid. Then we get cardiomyopathy. We get all types of problems. We get peripheral vascular disease. We can't get rid of the fluid. You see people with the elephant legs. All this right here, Lisa, is a piece of the pie that we need to be reminded about. These are the questions that you need to ask your doctor. Am I a risk doctor for diabetes? Why or why not? If I continue to have high cholesterol, what will that do to my body? What do I need to change? Help me with a diet control. Can I see a nutritionist? Make sure that you get the help that needed. We have insurance, guys. And even if we don't, we still have people that can help us, right? So let's stay healthy. Next slide, Lisa. I probably talked too long on that slide. How somebody asked me, how am I maintaining my blood pressure? One of the things that I used to love to do is put salt in my food before I taste it. I would sprinkle salt in my food and I wouldn't even taste it and it was salty, right? I did it at a very young age. I used to suck on lemons and have salt and all that stuff. Salt goes with what? Water. Water, if you don't get rid of salt, where does it go? Right? It's all compartmentalized. So you end up developing high blood pressure. So what I'm doing now, I rarely fry my foods. I bake foods. I try to eat healthy. I try to keep sugar out of my life. Not only that, sugar, when you get older, causes severe osteoarthritis. Severe. Okay? So sugar and caffeine is not good for us, right? So, and the other thing I'm doing is keeping my weight down. So I was just telling my doctor today, uh, I used to weigh 150. I'm 5'10", but I'm down now to like 140, right? I'm keeping the weight down. I'm exercising. I hate doing sit-ups, but I try to do something with my abs every day. Just even if I'm sitting in a chair, just going, look up and down, up and down, up and down, right? Just do something. because that fat is right there, and that's from estrogen, right? So, what is diabetes? Diabetes is a condition that's caused your blood sugar or blood glucose levels to rise too high. These high blood glucose level can cause damage in different ways, and diabetes make you more likely to develop heart disease and a stroke. Somebody just add, what do you recommend for? I can't see the rest of it. You can come off mute and tell me what you are asking me.
You had
Whoever
said that you recommended something for your husband to control his high cholesterol. I want to know what that was.
Okay, I got it downstairs. I can't remember the name of it, but it is he gets a shot once a week because my husband has bad LDLs. But I'm going to tell you, he's probably around here listening. My husband doesn't eat right. Black men, and I'm not saying black men, but in general, we got to get on the stick of eating right. Okay. So my husband still, when I fix his lunch, he might sneak and have him a donut, or he might go ahead and have him a piece of fried chicken at 7 o'clock in the morning, stopping by 7-Eleven. So I have to constantly monitor him. So I will make sure I give you the medication I'm giving him. He takes it once a week. Like I said, it's metabolized through the liver, not the kidneys, because he had a bad reaction to statins. There's so many great drugs that we can use that you should also talk to your doctor about. And this drug is not very expensive at all. So he just got diagnosed with hypertension. You see what I'm saying? But he's not diabetic yet. But because he has cholesterol, that fat has nowhere to go, is stored somewhere, right? He now has developed hypertension because of his hyperlipidemia. He has bad genes. Can't I can't say that it's his fault, but I can tell him that he needs to have better diet control. And Lisa, you have more than 30 million Americans have been diagnosed and underdiagnosed. And why do you think that people are underdiagnosed? Because we don't go to the doctor. Every time we go to the doctor, just like I said, he went to the doctor. He first had LDLs. Now he's got hypertension, right? He said, "Oh, every time I go to the doctor, there's something wrong." Okay, well, we have medicines to fix it, but we also have to be cognizant of our lifestyle, right? Next slide, Lisa. So how does it work? Your body makes and uses insulin, which is a hormone, to keep your blood sugar in a normal range. When you have diabetes, your body doesn't make enough insulin. People think sometimes it doesn't make enough sugar or can't use the insulin effectively. This causes your blood sugars levels to go up high, right? Next slide. So we went over this early, type 1 diabetes that I talked about. Your body just doesn't produce insulin at all. These are the tough cases right here, right? This says 5 to 10%, but the statistics has went up to about 15%, right? One of the things that they think that causes this is autoimmune or Epstein-Barr, or some type of some people have blamed it on vaccines, right? But definitely this type 1 happens more with Caucasian people. Type 2, this is us, about 90 to 95%. Your body is producing insulin, but it doesn't make enough, right? And it doesn't store enough. So it kind of fools, it kind of says, oh, my body is making enough, but it's not. So one of the things, I don't know whether Lisa has this on the slide because I can't remember the slides and I apologize, but we need to make sure we're cognitive of diabetes in pregnancy and also the symptoms. Your body is not able to make enough insulin and use the insulin it needs for pregnancy. I didn't get it, but I have had some women to get it, and they are very much out of control. Next slide, Lisa. So common risk factors that contribute to diabetes, we talked about cardiovascular, we talked about hyperlipidemia, right? Family history, genetic predispositions that may increase risk. Like I told you, my grandmother had it, my mother doesn't have it, my sister doesn't have it, but I might have it, right? Lifestyle choices, we talked about diet, physical activity, smoking. What does smoking have to do with diabetes? Who knows that answer? What does smoking actually do? It
It
constricts our
constricts
vessels.
blood
That's right.
vessels.
There you go. Right?
Yeah.
My sister smoke. She's one of those people that she goes to the doctor. Oh, my blood pressure is fine, but it's 150 over 90. She blames it because she went up the steps, right? But she smoked for ever since she was 14. She lives in New York City. We, that fast sugar life. But anyway, she goes and she says that, but now she's quit smoking because she had breast cancer. But she's doing what do they call it? That vape. That's just as bad. So I'm like, girl, please. Okay, medical history of high blood pressure. We talked about obesity and we talked about high cholesterol. As I said, everybody in my older sister should be on medicine. But I had actually, when I went into menopause, I actually got hypertension I've been on drugs since I was 45. I've controlled my weight. I've controlled my diet. I check my legs. I look at my ankles every day, make sure that I'm actually getting rid of that salt because food is naturally stored now with salt. Unfortunately, we have the worst food in the United States of America, but we just have to work what we have. Emphasize the importance of understanding the personal risks based on what is that, family and medical history. I'm sorry, I don't have
It
my
should be
glasses on.
family.
Okay, I thought so. Based on family and medical history. And that's just really knowing what your family history is, right? When you go to the doctor, they're going to ask you who in your family had this, and they're not being nosy. They just want to see what you're at risk for, right? Next slide.
Before we go on, Lillian, you're on the line, and I know you're having a family reunion and you're doing something special, and I just wanted to call it out.
Okay.
Wanting to, at family reunions, talk about your family history, talking about what's important so that people think when we don't talk about our family
Mm-hmm.
history, we don't know what we are at risk of.
True.
And Lillian, I think that's tremendous. Is there anything you want to share about how, you and your family have come to want to do that for one another?
Well, we did it a couple of years ago. There was a member of the family who was a nurse, and she made a presentation to the family, just tying in the history of who had in the family had certain types of illnesses and how it passed from generation to generation, and things that people should be doing to at least slow down the process and make sure it doesn't keep passing down from generation to generation. It's a tough sell because people, they're so used to living a certain way and eating a certain way. It's hard to change
That's
those
correct.
habits.
That's
Yeah.
correct. But you know what you can do? What I've done from my husband is I stopped cooking bad food, right? So that if
Right.
he get it, he won't get it in this household, right? He said we having what we have chicken. What do we having? Turkey, baked, not fried, right? What are we having for?
Mm.
Here's your veggies. Here's your fruit, right? Oranges on the table for him in the morning. Bananas for vitamin. All these things that it's a hard adjustment. I mean, like he used to shake salt like me. Now when we go out, if we go out to dinner, he said, "Oh, that's salty."
Mm.
Yes, because now you've taken salt out of your body.
But see,
So yeah.
I had to deal with that situation. I try to eat health and do my exercise. So we have this sort of battle with my husband sometimes. He does most of the cooking and he's a great cook. So I just don't eat as much. And he cooks a lot of rich food sometimes, but he's getting better. He's eating less fried food now because I don't eat a lot. I won't eat red meat. The air fryer is good. And we got an air fryer, which I think helps a lot
Yes.
instead of. Mhm. So I'm still working. I do fruit every day. I'm completely lost without my fruit. And now I've been able to get him to eat fruit because I fix it every
Right.
day.
Right.
Mhm.
So, it's small things like that you just have to try to incorporate into your daily life to make a difference. I do have a
Mhm.
question about the A1C.
A1C. Mm-hmm.
Yes. Um, when you go to the doctor, they do the blood work, but they don't always do A1C test.
Well, they should. You should
Mhm.
request it.
Exactly.
And the
What?
reason why they might ask you a question. Even what did Lisa? One of the slides say we're either underdiagnosed or not diagnosed at all, right? Or diagnosed with or underdiagnosed. Why are we underdiagnosed? Because that just because they take your history and you don't talk about having diabetes, right? Or maybe you don't have hypertension, it doesn't mean that you're not at risk, because diet and exercise, if you're not doing that, puts you at risk. So sometimes your doctor may ask you, how, tell me about your exercise pattern. Do you exercise 3 days a week? That's not why they're asking like to be nosy. They're asking so they can see your sedentary lifestyle, and do they need to do an A1C? So everybody should get one done, right?
Well,
And
that's what
if
I asked my doctor about it, and I asked her about doing one. She said I didn't need one.
did you ask her why does she feel like that?
She said, well, she said it's because of my history and the other test results and my lifestyle. But I may ask her again, do one just to prove to me I don't need one.
Do you get it? You don't do it annually? She doesn't give it to you. She doesn't.
Annually, yeah.
No, she has not given me one. Johnny gets one every 6 months. Every 6 months, every year. So when I go back this time, I'm just gonna ask her to give me one. I've asked her about it, but she said I
So
didn't.
yeah, she should include it, but you know what you tell her? You said, I'm concerned. First of all, I listened to a great presentation. And you see that Black or African American? They said that I am at 30% of having what? Cardiovascular disease.
I don't
Although
think
I
so.
might tell you that I'm doing A, B, and C, that's not always my reality, right? So for me to make me feel like a better steward in controlling my healthcare needs, I need for you to listen to what I need for a change. And you don't have to say it like that, but I'm just telling you directly, like, this is what I'm requesting. Now, if there's insurance problem, let me know. Because, see, this is why I'm saying it's important. This is why they take our history and they make decisions, and they don't look at the patient, they don't look at the statistics of Black females that have what, strokes, we Alzheimer, dementia, diabetes, all these things that we're talking about, right? And then you could see that Lisa has up here
Mhm.
Hispanic and Latino, that's probably their diet, and they eat
Yeah.
foods, pork, and all those. Black American, and we talked about that Asian Pacific. So we
Mhm.
talked about all these things. So I would request to my doctor and say, I'm concerned. Can we just do a baseline? So at least she has a baseline, right? And if it's something changed, then you know. Just ask her for a baseline.
Always advocate for yourself. Do not let them tell you no. If
Yeah.
they tell you no, find another doctor.
Yeah, I kind of agree with that one if she's not
Yeah.
doing an A1C.
And to tag along with the changes in our diet, even when you go to restaurants, if you're ordering something from the menu, you can ask them to marinate, do the marinade or plain. I know I do it with things like salmon and those things because
Mm-hmm.
I find even what they use in those is really salty as well.
It's
And
salty.
the chefs will do exactly what you ask. So anywhere that you are in restaurants, that's a way also to improve our eating habits.
You're exactly right. That's exactly what I tell them to do as well. I stay away from French fries, potatoes. I want them. I would love some McDonald's French fries, but my body says, "Do you really want it?" Right? And as we get older, our system slows down, our organs slow down. We can't metabolize drugs the same, and that's just a part of reality. We growing old gracefully and not being sick. So you also more likely to develop type 2 diabetes. We talked about I have a family history, diagnosed with pregnancy, not enough exercise. People don't believe that sedentary lifestyle doesn't do anything. And not only that, arthritis, guys, which is now one of the number one problems with anybody, like males, females, more common in females, and quality of life. And I drive a lot, so I have to remind myself to get out the car and just stretch. In the morning, we should be doing some type of stretching exercise, something to just get our body loose. I just brought me yesterday a nice, comfortable bed that has vibration on it that you can put your feet up. You know how your doctor says, "Oh, elevate your feet." Well, guess what? Suppose we don't have the stuff to elevate. If your doctor tell you to elevate your feet, put some pillows up under your feet and just raise those feet up to get that circulation going. That's all they're telling you. Get that fluid going around, right? Because when we're at rest, we're at REM, we don't know how much sleep we're going to get and how much we're not getting, but we know that having a great bed now, statistic has said that it really increases the our body, our osteoarthritis, and not only that, the quality of life. Because when you don't get enough sleep, you are stressed, your blood pressure goes up, every part of your organ is affected. The other thing, being overweight or obese, if you are overweight, you have to commit to losing that weight. You have to. It is the number one problem in diabetes, and that's what happened to my grandmother. My mom's 6'2", I'm 5'10", but my grandmother, believe it or not, is 5'3". She developed diabetes at 65, and she shouldn't have been put on insulin. She should have been put on pills. But my grandmother believed everything the physician says, so he was really nothing wrong with her pancreas. So he put on insulin, and then, after years and years, she developed peripheral vascular disease. She had all types of hypertension. She had um, her LDLs were out of whack. And one day I said, "Oh, what's wrong with your foot?" I didn't feel a pulse. She was like, "Oh, it's fine. It's fine. It's fine." And, we did surgery and she ended up losing her leg, right? She still lived 10 years afterwards, but it took a piece of her, if you know what I mean. I would not want that to happen to any of us. So that's why these three problems that we tend to have extremely young: cardiovascular disease, diabetes, and hypertension. Remember, I told you I was diagnosed at 45. Look at this, 45 or older, right? I mean, I don't feel like I was, again, I was telling you I was salt shaker, right? I ate probably anything and everything, but I didn't understand, the value of nutrition, the value of exercise, and the value of taking care and having ownership. And I've been a nurse for a long time, but just because I'm a nurse, it doesn't mean that we do the right things. So as we get older, we have to train our mind and our body to do something different. Like my doctor just told me, get rid of the coffee. Coffee causes arthritis. I've got a little bit of arthritis. I got rid of it really fast. Okay. Get rid of sugar, arthritis, right? So these are, things that we can do. People with diabetes have a high risk of heart disease. We talked about, Lisa, and it's managed and damage your blood vessels, right? And when it damages your blood vessel, what we're talking about is that clot that I'm telling you, that it squeezes some part of your body is really not working. So it's the plaque that is the leading cause of heart attack. But don't forget the stroke too. The brain is a closed system. When you have that stroke, it is left side, right side. It can be, sometimes they call it TIAs, right? You don't want that to happen to you. Go to the doctor, even if you have to go every 6 months. I get a bump, scratch, bruise, something happens to me, I go. Next slide, Lisa. So people living with type 2 diabetes often have risk factors. We talked about that. High blood pressure, unhealthy levels of cholesterol. We talked about obesity, and we talked about lack of physical activity. All these are contributing factors, right? Maybe not the cause, but contributing factors. Next slide. So here are 4 questions you should ask your doctor. What changes can I make to take care of my heart? What can I do before my next appointment? How will I know if those changes I made is making a difference? What resources can you help me learn more? So I would say this. Another question, doctor, I'm really concerned about my health. I would appreciate we have that dialogue of, one, if I have a follow up, if you give me something, I would like to follow up in 3 months, right? So if somebody puts you on a medication, the follow up should be at least no longer than 3 months. If you go on a high blood pressure medicine, you start coughing, that blood pressure medicine is not made for you. That is a side effect. We did not go over the side effects of diabetes. We did not talk about the symptoms, and I wanted to talk about this because this is important. You might have increased thirst. You might be urinating more than normal. You might be eating more than normal. You might have weight loss. I've had significant amount of weight loss. That's probably why I'm pre-diabetic, right? And then you're fatigued. And this is the fatigue where you feel like you can't get out the bed, right? This is not the fatigue of working hard. This is that type of fatigue. I can't move. What is going on, right? These are warning signs, right? That you are probably right there a diabetic, right? Right, those symptoms right there, you're diabetic, right? Okay, next slide, Lisa. Any questions, guys?
I wanted
So
to add,
underrepresented.
I just wanted to add one comment about the signs and symptoms because we didn't talk about it. You said, I don't think you mentioned the blurred vision.
Blurred vision, that's an early stage. That's correct. And
Yeah.
then remember, we talked about if you like, for example, I dropped something on my foot and I was like, oh, this is taking a long time to heal. And that was one of the first things when I went and got my A1C check, right? Because I know that my healing process is quick, right? And I dropped something on there and I was like, oh, this is taking a long time. It's little subtle things that we might not think about, but when you even Google it, the Google is right, right? It's like blurred vision, difficulty, like I said, the healing process, right? Little small things that we need to just really try to pay attention to. So the challenges that we have is really the same challenge that African Americans has had for years. It's access to healthcare, right? It's insurance company. It's Let me tell you, I grew up in New York, and I'm just going to tell you that my mother could not afford and have insurance. But back then, the health department did the same. I mean, they were just like our bread and butter. It might not be like that now, but there's always places where you can go and understand how you can have insurance coverage, right? Because that's really important. But the best thing we could do is prevention. We get diagnosed, we treat it, and then we talk about um Mark said something in the group chat, catching up. Diabetes and cardiovascular disease. Social economic factors. When I think about when I was growing up, fruit was, again, it's very expensive to eat healthy. It's expensive. Why do you think in every African American neighborhood there's a McDonald's or there's some type of junk food on every corner, right? Right? Or there's alcohol, right?
Mm.
How much, people drink alcohol and say, oh, I got high blood. Where's sugar in alcohol? And you drink wine, it's sugar in wine. All
Mm.
that raises your glucose. And don't forget, guys, stop eating after. You should not be eating after 6:30, 7 o'clock. 7 o'clock is the latest, right? Um, so these things that's in the middle, education is really important. And you know, we're really important. What this group is doing now is really important. So if you have questions, feel free to ask. I went to Walter Reed today. And if you have VA benefits, remember, guys, everything is free if you spent more than 3 years in the military. So I want to say that if you don't know that. But they had nutrition cards, and I grabbed two of them. I was like, wow, this is really cool because it is a way that we can learn about what is the right thing to eat. Like, what is whole grain, right? What is this? What is that? Why do I need to eat beans and proteins and all those things? What does that do for my body? These are things that we have to understand. Again, when it comes down to drugs, right? Here, I'm going to give you a story. A friend of mine just had jaw surgery. It was a male. They did not want to give him proper medication because they thought a black male would get addicted to Oxycontin, but he had major surgery, right? I'm
Mm.
saying that because black individuals, metformin, it was a big suit out about metformin, right? Number one drug that they give us, right? Causes kidney problems, causes kidney damage. I've known people to go on dialysis because they have metformin. But they tend to give us old drugs. That's not because some of it is our insurance carriers, guy. But some of them, if you want the newer drugs, doctor, is this the best drug for me? I understand there's newer agents out, and guess what? They have that. Some people have those little cards that you can get, and they give you free drug, free copay, free this, free that. We don't know what's free until we ask. Ask the next time when I want a newer medication, how can you help me obtain that? Do you have any types of programs that I can take this medication, right? And I can get that drug free. Because you know what? I really, really want that. And so Lisa has put in here key areas to focus on for ADA and AHA effort addressing health inequalities, right? We have community education, the knowing diabetes by heart. All these slides will be available for you after this. Research and advocacy, right? Improving access. That is the number one thing that I believe that we're still lacking. Improving access to care. And guess what, guys? Some of it we have control of it, and some of it is our insurance carrier. You go here, you go there. No, you can't go this. You got an HMO. You got to. Oh my God, where's your insurance card as soon as you get there? I'm like, really? Can I say something before you ask for my insurance card? So I'm just saying, we live in the United States of America, and access for us is not the same. And that's if you have insurance or you don't. So we need to work together as a group and continue to educate and provide resources as we do and spread the news, guys. We are not spreading the wealth about what we should be doing. And guess what? We don't have to call people obese or fat. We could just say, this new drug out, Ozempic, I don't know. I've seen a ton of people take it. I'm kind of skeptical of it. But why not do things the old fashioned way so we can keep the weight off, right? So you have it right here that I was just talking about. Eating healthy, lifestyle that's, we women shouldn't have more than 2 drinks a day, right? Regular exercise, stress management. We're living in an environment where everything is stressful, right? We don't know up here in Washington, D.C., people are losing their jobs, meditation. What do we do for relaxation? When is enough to tune down and tune up? Listen, if you haven't been on vacation, that job will be here when you get back. If you haven't take time to relax in a day, shut it down because stress brings along what? Your immune system. Your immune system got
Yeah.
out of whack. You've got inflammation. Inflammation brings on what? Problems, guys. Right? So remember that parasympathetic and some wait, guys. No, I'm not going to say that. But flight or fight response. We need to learn how to tone it down. Smoking. Look at that. Well, we not only we're going to talk about smoking, but we're going to talk a little bit about drug use. Right? Drug use is prevalent in African American communities. Why? It's there. So when you see somebody at 35, you have to wonder, are you really having a heart attack or if this is drugs, right? We know that the types of drugs that they're using now causes all types of heart problems. Arrhythmias, right? Arrhythmias meaning the heart is just beating out of control. We don't know what's going on. Now you got risk of cardiovascular disease. So some of that mixture is us. Some of that mixture is not always brought on by hypertension, but we need to talk about drugs in our neighborhood. I don't care what you say, they're not good. Molly's, anything, marijuana, all that stuff is not good because marijuana is not marijuana anymore. It's synthetic, right? So following your heart healthy diet, reach it and maintain a healthy weight. Start off with like, I want to lose 5 pounds, right? Take that salt out, start eating healthy, eat smaller portions, eat frequently, but smaller portions, right? Be active, properly manage your stress. That's really a good one. I need to learn that. Take your medicine as prescribed. Again, I have to remind my husband, did you take your medicine? He said, I'm gonna put it on my thing well, you forget. Take your medicine. If you have to help them, your significant other, remind them it's okay. Right? Next slide. Support groups, right? Join support groups. Like I said, my grandmother lost her leg, so she was in not a nursing facility, but she was in assisted, not assisted living, but over 55. But they had support groups there. They talked about what it was like. She still thought her limb was there, right? She had phantom pain. People don't talk about that. She thought her leg was there, and sometimes as she got older, she thought she could get up and walk where the leg was not there, right? So we're affected. Find out about community health programs, workshop, talk about it, encourage, share. Don't be shy. I've been doing a lot of talking, in which you guys need to chime in if you think you can you make a difference. Yeah. So Lisa has some question here. People with diabetes are 2 times more likely to develop complication from heart disease. True or false, guys?
True,
Right.
True.
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 Yeah.
True.
Next slide. True. That's correct. I can never eat anything with any sugar in it ever again. True or
False.
false?
False.
False.
It's false,
Yeah.
but you feel
False.
like it's true.
You feel like it, right? Yep.
Yeah.
But what are your good sugars? Is there such a thing?
Mhm.
Natural sugar.
Natural
Now,
sugar.
that's a sugar.
Natural sugar.
Like
Yep.
in
Honey.
fruit?
Yep.
Yeah.
What about honey?
Honey.
Um,
Be careful.
yeah. I don't know about honey.
Yeah, I'd be careful.
What about the
Yeah.
monk fruit?
Honey is 8 times sweeter than sugar.
Say
What?
that again.
He said honey is 8
No.
times sweeter than sugar.
Yeah, I didn't think so.
But it doesn't
Yeah.
have added sugars in it.
Got sugar you when
That's
they
where we get in trouble because we don't know.
Well,
Well, you got to read the label.
Yeah.
Everything has to have a label on it, right?
Mhm.
Yeah,
Mark
honey
said
is better
honey
than
is better
processed
than
sugar.
processed sugar.
Mhm.
'Cause
Agreed.
it does,
Right.
yes.
Does
Anything,
everybody know what processed sugar is? What's something that has processed sugar?
cookies,
Everything
cakes,
that's not cake pies, everything
Fructose.
that's cake pies and
Anything is toast.
everything that's good.
Everything that's good.
There,
Almost everything,
Susan.
like that Krispy Kreme donut with that
Lord.
coffee. Woo woo.
What
So
about that cane brown sugar? I forgot what you call it, as opposed to the white sugar.
I tend to use that. I know what you're talking about, the raw sugar.
Yeah.
Yeah, that's what I use.
That's what I used to. Again, I don't use much sugar on anything, but I do like it on my oatmeal. But not regular sugar. But
so,
you can get around that because I started putting strawberries rather than sugar. See how I just got
right.
around that? So
Or
tastes the same.
raisins.
Mine
Yep.
is raisins.
So
raisins have a lot of sugar. They have a
Yeah.
lot
Yeah.
of sugar, yeah.
Yeah.
Lot of sugar.
So rather than cooking with sugars or brown sugar, I use date syrup or maple syrup. It gives the sweetness but less. So like if I'm doing candied yams, I'll use something like that because it has more natural sugar
Mm,
than is
Right.
refined. And I took that from, if you remember, Teresa Vaughn, who was
yeah.
on talking about the natural things.
Hmm.
That's what I started looking at to provide natural sweetness, and you don't need but a little bit of it.
Right. I like these bikes right here because I'm trying to convince my husband, let's get a bike, but you be in the front and I be in the back, like they used to do in the old school. So I'm trying to get him to buy one of those for us so that he can do all the pumping and I can do all the riding. Together we together we can foster a community supporting each other, sharing and taking proactive steps in managing our health. Thank you for being here today. I'm open for any questions. Lisa, I will make sure I send you that medication that my husband's taking. And other than that, any
Thank you,
questions?
Cynthia.
Can you get Cynthia to come back and we can go into more details?
I will be
of-
glad to come back. Just let me know. It's just busy at work, but I love this because we're talking to our people, we're educating our people, and I just believe that education meets what opportunity education helps us live longer, right? The more we're stewards of our own health and we take responsibility. Hey, listen, I want to have quality of life, right? I don't know about you guys, but that quality matters to me, right?
Yes.
Yeah.
Cynthia, hey, Lisa, can I ask a question? This is Charlotte.
Sure.
Yeah.
Yes, Cynthia, I am diabetic and I also take the metformin for that.
Hmm.
And I also have cholesterol, which I've been taking one of the statins, a torvastatin. And they initially they were saying that if your LDL is lower than 100, then okay, you're okay. But now they're changing the goalpost. So what is that number now for your LDL that is a healthy number?
So I'll have to look that up, but for African Americans, really, the American Heart Association comes out with different tools every year, right?
Okay.
Mhm.
African Americans always have a uh, lower than normal because because the genetics of our body. We didn't get
Okay.
into this, but that's why it's so important to participate anytime you get an opportunity in a clinical trial, whether you're 40, 50, 60, 70, 80, 90, it doesn't matter.
Okay.
Participating in clinical trials really give us the answer because our body is so different. But what I would tell you is to go on American Heart Association and see what the new guidelines are. Keep it in
Uh-huh.
mind that don't go by, make sure you look at last year. This new administration, we've got people in there that might not give us the right information, but that the
Okay.
new one came out before our new president. So those have been updated. So go to
Okay.
American Heart Association and it tells you even about our blood pressure. You could get put on blood pressure now if you're African American, if your blood pressure is 120 over 80. That's the starting rate now. That
Oh
is
my
that is
God.
yeah,
Oh.
that is what they consider now for African Americans to be essential hypertension, right? We didn't go over all that, but yes, you can. They've done studies saying that gradually it will go up for African Americans. African Americans, we tend to hold on to renin that's made in the kidneys, which makes our blood pressure go up. That is released from stress. That's why we talk about you need to have some downtime for you. Relax your mind, relax your thoughts, get everything off. It's hard for us to do because we are doers and we don't know how to stop, but relax. It is so important. I've had to learn how to relax and let things go, meditate, whatever I need to do. When I shut it down, it's shut down. You know, learn that. That's extremely, teach that to your kids. You can't work forever, you can't do forever, but you can learn how to relax. That's hard for a lot of people. So
Yeah.
I hope I answer your question, Lisa. She can
Yes.
get that off for the
Yes.
Yeah, and
got it.
Thank
Gwen,
you.
and Gwen put the LDL in the chat, and I was going to say not the exact same thing you have in there as that number, but if you already have heart disease and diabetes and some other things, they may be trying to do something even less, right?
Mm-hmm.
Than
Yeah.
100 down to 70.
Right.
So it's very important, Charlotte, that you understand what your risk is, what your health is, and why
Right.
somebody may be trying to keep you down. If you're on all those numbers of medications for that reason, they want you
Right.
as low as you possibly can be.
And
Okay. Thank you.
maybe
Okay.
if you're
Thank
on
you,
a lot
Lisa.
of medication,
Uh-huh.
maybe if you're on a lot of medication, let's regroup and think about what we need to do different, like I did with my husband. Because
Well,
it's
yeah.
no need to take 50,000 medications. I just don't believe in that. We
No,
regroup.
We can't
yeah.
believe in it, but we can't begin. We have to make sure that there is a good plan with your physician to
Yes.
help you come off of medication in
Yes.
a healthy way. So what
Absolutely.
Cynthia is saying is, if we can do it without medication, we want to, but there has to be, like any good soldier or person, we need to
Right.
have the plan to
Yes.
get that in order so that we don't do anything that makes our health
Damages.
worse
Well,
than
yeah,
And
what we're
those are
doing.
the only those are the only two medications that I do take because I'm one of those ones that do not like to be on medication. So
There you go.
what
That's
I
good.
take those two and no more.
well,
That's
none of us like to be there, but remember, fat, we talked about hyperlipidemia, and then I'm gonna stop talking. That fat clogged arteries leads to what? Stroke, clot, all
Mhm.
that. So if we
Right.
control that with healthy eating, and sometimes it's just like my husband, it's just family risk factors. You know,
yeah.
we have sometimes we don't have control. So if we're born with it, we don't have control because, like I said, he's had high cholesterol since 20. We have to learn how to live with it. What can we do?
Yeah. This has been great, Cynthia. Thank you for pulling things together
Thank
to let
you.
us know how it's connected. But my takeaway from what you shared is this: diabetes, stroke, leading to cardiovascular disease. All of that is talking about vascular damage of some way.
Mm-hmm.
And it stops it's impeding the flow of the arteries and vessels. So our heart is ultimately affected. So we want to understand that we have several ways that we know that heart disease is there. Please, this slide deck will be available to you. The American Heart Association and the American Diabetes Association have paired together. They didn't always do that. They were separate entities, not working together. But what this demonstrates to us is that collectively they've recognized the risk of cardiovascular disease from stroke and diabetes, and they have resources. Let's not be afraid to tap in if there are things that we want to learn and use their resources to provide us more information. So thank you, family, crew. This has been great for me. Cynthia, thank you very much.
Absolutely.
In September, in July, we're gonna have something on eye health. Okay.
Wonderful.
So while we understand blurriness and diabetes and that, but it's time to talk about these spectacles and cataracts, glaucoma. If you have a suggestion, I haven't identified anybody yet, but I will find somebody good for us. But we want to talk about our eye health in July. And then we'll take a break in August. We're all supposed to, like Cynthia said, go on vacation, enjoy ourselves, and then we'll come back in September and October, and we'll really dive into some health disparities. But if you have some topics between now and September, let me know. And Japs and I will work on that. So, okay?
Okay, give us some topics, guys. Wonderful.
All right.
Thank you. Have a wonderful night.
Thank you.
Yeah,
Have
thank
fun.
you.
Okay.
It was great as always.
Yes.
Oh, thank you. Thank you.
Excellent. Excellent.
Oh, good. We're trying to continue these conversations, bring a little bit of something, as long as you got a little bit to take away each time. You know, a nugget is worth everything. My nugget was the questions that we should be able, when you go to the doctor and you want to know what to ask them, give you some questions to ask your physician when you're leaving. So I think that's important, something we can do. Okay.
Very good.
Yeah. Nice. All right. I just got a text from somebody who said 1 hour is not enough. We need more than that. Sometimes those topics, we do need more time, but if we go too long, y'all will be like, it's too long. I'd rather make it short and we go over a little bit than it is, make it too long and people stop coming because they know it's going to be too long. So
I'd like to ask two things of Lisa. One is a request, another is another thing. One, can we have a bring a friend session? These are great. And we need to ask people to say, listen, you're coming to this and thanks for coming. And hopefully you're being fed and being blessed by it. But tell others in your network, come be a part of this. In these times, the way things are going, we as more than ever need to make certain that we're building our network of capability and infrastructure. That's that. Number two, I discussed with you briefly, Lisa, last year maybe, about the possibility of recording on site one. It may be at St. Peter, maybe at our site in Texas and other places. I'm hoping you and I can revisit that and maybe sometime do this very thing, but have it be broadcast from wherever we're doing it and sort of get this on tour. We'll talk about that more later, but I just wanted to put those two out there because I'm juggling. I got one more meeting at 8 o'clock and I'll be good. But thank you. Fantastic work. Very enjoyable.